Okay, not so clear topic about glomerulonephritis, the autoimmune inflammation, autoimmune damage of the kidney can be easily explained by this picture. So, in a normal state, you have a nephron. It's an incoming artery, outgoing artery. The artery, the area of filtration, where liquid part of the blood and substances due to high blood pressure are filtrated to the Bowman capsule, to this space. This is the membrane, a thin filter that spoils molecules, substances, and for some reason, for some way, water from filtering. Is the first barrier. Here is the cells of the Bowman capsule. It is the second barrier. It spoils from filtering, it spoils substances and water from filtering. It is the second barrier. So in normal state, for about 600 milliliters of blood are going here, but only 120 milliliters of blood and substances that are dissolved are filtrated. It's a normal state. If a patient has a glomerulonephritis, an autoimmune inflammation, what happens? Due to inflammation, there are two kinds of glomerulonephritis: non-proliferative and proliferative. What is the difference? Non-proliferative involves the membrane and the cells of the Bowman capsule. Those cells are called podocytes. What happens? Due to inflammation, the membrane becomes penetrated and the second barrier becomes penetrated. That is why, if it's in a normal state, the filtration goes like this. But when the membrane and the cells are penetrated, the filtration becomes more severe. The barrier is lost. That is why more liquid part of the blood goes to the Bowman space, more substances go to the Bowman space, including red blood cells. So, the filtration of albumin into the primary urine will be increased greatly. The filtration of red blood cells will be increased. The filtration of liquid part of the blood will be increased. What will happen if the body loses albumin through the Bowman's filtration? It will lead to decreasing of proteins in the blood. Decreasing of proteins, decreasing of volume will lead to losing of the blood pressure. Not so severe, but will. Also, it will lead to losing of oncotic pressure. Oncotic pressure will be lower. That will cause the going of the liquid part of the blood from vessels to tissues. This will cause edema. To prevent this this event, the liver will increase the synthesis of lipids into the blood. So, a patient with non-proliferative kind of glomerulonephritis will have a severe proteinuria, red blood cells in the urine. At the beginning of the disease will have polyuria. This patient will have an increased level of lipids in the blood and edema. So, proteinuria, hematuria, hyperlipidemia, and oncotic edema are markers of non-proliferative inflammation of the glomerulonephritis. Remember that the blood pressure is not increased. Another group of glomerulonephritis is a proliferative one. What happens? Autoimmune inflammation causes the damage of the barrier. The filtration becomes more severe, but inflammation attracts immune cells into the space of the Bowman capsule, into the wall of the Bowman capsule. This proliferation causes additional inflammation, additional edema that can lead to creating of a barrier to the filtration. So in this case, patient will still lose albumin into urina. This one. The patient will still lose red blood cells into urina, but the edema will block the loss of water. The losing of water will be not so severe. In some cases, edema will cause the blockage of filtration. In this case, the blood pressure will be highly increased because of the liquid overstock in the blood circulation. The level of lipids will not be increased because the pressure inside the vessels is high. The situation is not like in this case, where the oncotic pressure is severely decreased. That's why lipids will try to compensate this losing of oncotic pressure. In this case, the blood pressure is increased due to water overstock. That's why lipids will be not increased. Edema will happen not because of the losing of oncotic pressure, not because of losing water due to loss of oncotic pressure, but because of the severe high blood pressure. That's why in this case edema happens due to increased blood pressure that compresses and pulls the water out of the vessels. That's why patients with non-proliferative glomerulonephritis will have low, not high blood pressure, normal or a little bit high blood pressure. They will have severe proteinuria, severe edema due to loss of oncotic pressure. But in proliferative glomerulonephritis, patients will suffer from severe arterial hypertension and edema that was caused by this pressure. Proteinuria will be not so severe, not like this one. But hematuria, red blood cells in the urine, will still be in both cases. That is the difference between non-proliferative and proliferative. Non-proliferative is much more milder than proliferative. Proliferative version of glomerulonephritis leads to glomerulosclerosis more rapidly than this one. That is the difference.